and it's just for the safety of everyone. And at the end of this session, we're hoping that you have a more informed decision, whether to take it, whether to tell your family and friends, your parents, and also yourself, or whether to not take it as well. But the decision will be yours at the end, and it's not to, we're hoping that it'll be unbiased, but it'll be well informed. Hopefully as well, we'll have, we've got 4 doctors and another patient, not a patient, sorry, somebody who's taken the vaccine a while ago, and then Dr. Mansky, who's one of the one of the guests, he will talk about his experience having actually taken the vaccine and what it's actually been like. And thank God they're all still alive, so hey. I'd like to introduce the doctors on here. If I can go to ladies first. I will go to Dr. Jessica Fletcher. You can introduce yourself and your line of work, where you're from.
Hi, my name is Jess. I am from London and I work in mental health.
Sorry, you work in London. What's your...
I work in mental health.
You work in mental health, okay then, sure.
I work in mental health in London, yeah.
Dr. Priscilla as well, if I can introduce you.
Hi, my name is Priscilla J. Bafour. I am a pharmacist in the United States. Currently, I practice pharmacy in Maryland. I am originally from New York, but I moved here for work. So right now I hold the position of a pharmacist at the Walter Reed National Medical Center in Bethesda, Maryland. And previously I had a position as a retail pharmacist at a chain, prominent pharmacy chain in the United States. So yeah, that's it.
Thank you. I'll move to Dr. Akwesi as well in America.
Hi, good afternoon and good evening. I'm Akwesi Afriye Boateng. I'm a urologist and based in New Jersey, in the United States. Thanks for inviting me.
Thank you. And last but not least, he's in Ghana experiencing a power outage, Dr. Mansky.
Hello. Sorry for my video not showing. I'm Dr. Emmanuel Amankwa, also called Dr. Mansky as well. I'm a general practitioner with interest in infectious diseases, and I'm also a media personality as well here in Ghana as well.
Fabulous. Thank you all. I'd like to express my gratitude in the beginning for your time and efforts as well. We do really appreciate it. If I can ask also if you're not talking, if you can put yourself on mute, because we'll have other people in our household that don't respect always what we're doing. First of all, just to get the definitions out of the way, can I get one of you to answer what a vaccine actually is, what comorbidity is, and then mRNA, just so when we're flashing words around, it doesn't go over people's heads and the information actually is taken in. So vaccine, what does it do? Comorbidity, what does that mean? And then also mRNA. Floor is open to anyone.
I'll go. There are a couple of ways to create an immune response with regards to infections. So when one gets an infection, whether it's a common cold or whatever, the body has a way of remembering that infection so that if it happens again, it can deal with it more effectively. So throughout hundreds of years of human innovation, we figured out that if there's a way for us to introduce the pathogen, the disease, into the body where it doesn't cause as bad of an infection, then we will be protected against it. And that's essentially what a vaccine is. A vaccine is a way of that if it happens again, introducing the body, it can deal with it more disease, and allowing the body to remember that disease so that if it encounters it again, it'll be able to deal with it more effectively.
Okay, thank you. Also, so we'll move on. So if you say a word, please give a brief definition for layman's, because hopefully it will be streamed on YouTube, and hoping that our aunties, my mom who's a cleaner, can access the information that we're giving out. Can I ask somebody as well, how are vaccines made in comparison to how these 3 vaccines are made, the ones in your country? So we have doctors from the United States, doctors from Ghana, and then doctors from the UK. So how are vaccines generally made in comparison to how this vaccine is made?
How do you mean made? Like produced or?
Yes.
Like trials?
Both.
Oh,
so
okay.
the trial process and also generally how it's made.
Okay, so as far as how vaccines are produced, normally what they do is that they acquire either the actual virus that they're trying to combat. They would either make it a dead virus. They would make a dead virus and compound it along with some inactive ingredients. And they would normally manipulate they would just manipulate the actual virus itself in order for it, once it's injected into the body, your immune system will react in a way as if it's actually in. That way, by the time that you're actually exposed to the actual virus, your body's already set up to know that, okay, well, we know how to combat this, and there would be a response, and therefore that would make you immune to whatever given virus.
Also, can you clarify when you said inactive, what does that mean? Because some people have a fear that if you inject me with the virus, I could then react negatively towards it.
So there's either a dead virus or a live virus. A live virus will be like the actual, for example, like the chicken pox. That would be considered like a live virus. So scientists would basically use the actual virus and manipulate it in a way that once it's injected into the body it would have to create an immune response. And that way with that immune response, it's basically as if it's basically injecting the actual virus into your body. But with the dead virus, it's inactive. Therefore, the body is basically responding to certain replicas of the virus. That way, when you're actually exposed to the live virus, it creates a response that will basically make you immune to the virus.
Thank you. And also, can I ask Dr. Mansky first, what type of virus vaccines are available in Ghana and how they differentiate?
Okay, before I go on to that, I wanted to share some background on vaccines as well, how it started as a whole, how vaccines came about, if I can go ahead with that.
Yes, you can.
Okay, so many years ago, about 1796, we had this doctor called Edward Jenner. Now, he's an English doctor, and then he realized that with the outbreak of smallpox, they were actually milkmaids who had been infected with cowpox were not getting infected with smallpox. So then he decided that, okay, so he would purposely infect people with cowpox, which was relatively very safe, mild form, and see if people who he infects with cowpox would develop smallpox. And that is how vaccination started. That is how it came about. So he realized that using a lesser form of the infection can stimulate the body to produce antibodies to protect you from developing that major infection. So that's the basic history, the background for vaccination. Now, from then, 1796, science has developed, research has developed, so it's built on that technology, modified it, where we have various types of vaccines that we are using now. We have the live attenuated vaccines that we give. These, what Dr. Bafo explained, you have the virus in a weakened form or non-virulent form, which we actually introduce into the system. Now, the mRNA ones are a bit new to the block, even though it's been discussed for some time, where they take the mRNA off the particular antigen, in this discussion COVID, and then use it to stimulate an immune response, or the viral vector, where they pick up another virus, the adenovirus, and then an antigenic protein from the COVID attached to it, and then inoculate the subject with that. So on the general, we have the vaccine process that we usually vaccinate against the young. In Ghana here, the babies go through their scheduled EPI programs, vaccination programs, where they have all the BCG, the polio, the penta with the hepatitis, rubella, measles, and meningitis as well, and pneumococcal vaccine as well. Then comes the hepatitis B vaccine that we have as well, which later for older people, they can also take that. Then we even have the HPV vaccine as well against cervical cancer for young ladies. That is also out there. But I think COVID is more known, so more attention has been drawn to the COVID vaccine.
So what are the different COVID vaccines in Ghana that are available?
So in Ghana currently, we have 2 COVID vaccines, the AstraZeneca Oxford vaccine and the Sputnik vaccine. The rollout currently is for the AstraZeneca Oxford vaccine. It's a viral vector. Both are viral vector vaccines.
Okay. Can I ask Dr. Akwesi in America, what vaccines are available there?
Sorry?
So Dr. Akwesi.
Yeah, here in the States, we have we just added a third. We have the Pfizer BioNTech vaccine, which is an mRNA-based vaccine. We have the Moderna, which is another mRNA-based vaccine. And just recently, the Johnson & Johnson, which is a viral vector vaccine, got emergency use authorization. None of these vaccines, just to clarify, none of these vaccines have been, formally approved, by the Food and Drug Administration. They've just been granted emergency use authorization because, we're in an unprecedented time, and the amount of time that it takes to really get, a vaccine, thoroughly evaluated. It's a very, very long time. I mean, most vaccines will take, many, many years, maybe even decades before they get approved. So these are all approved for emergency use authorization here in the States.
So I think some people's fear is the speed. So we've cut out time. It's been made within less than a year. Most vaccines are made, as you said, longer periods of time. So what's been missed during those periods of time where this has been fast tracked? So what hasn't been?
I think, yeah, in vaccine development, there are a couple of things that are very important. There's safety, and there is efficacy. How safe is a vaccine, and how well does a vaccine work? Then there's a third component, which is long-term consequences or long-term safety. So we know that these vaccines are safe in the short term. I mean, we're talking about maybe three months, up to 6 months. They work well. What is missing right now is a long-term safety, and that is being, they've approved these for emergency use by basically weighing the long-term unknowns against the current severity of the virus, and so that's where the trade-off is.
Right, that makes sense. So therefore, we do not know what the long-term effects could be. It could be similar to other vaccines, or it could be slightly worse. Is that the statement as well? We just don't know.
Yeah, I mean, we don't know. There's no. I'm not sure if there's any statement that can be made. We do know that for instance, the viral vector vaccines, they've been around for a very long time. It's probably one of the most common ways of making a vaccine, and so you can extrapolate you can assume that how it is for other vaccines is the way that it's going to be, for instance, for the Johnson & Johnson vaccine, because that's a viral vector. For the mRNA vaccines, they're relatively new. They've been around, they've been around since the original SARS, back in, early to mid 2000s. So they've still been around for over 10 years. They weren't as widely used, but there hasn't been any long-term consequences of those vaccines that were developed for the original SARS, SARS vaccine originally back in the early 2000s.
So let me thank you for that. So based on what Dr. Kwesi's just said, if I can throw out, why would I, or what would make me then trust the mRNA type style vaccines? This question is open to anyone, over the viral vector style vaccines, since that one has more history. And if there were side effects, I could compare it to, if there were long-term side effects, I can compare it to the other vaccines that are similar.
Sorry, can you repeat the question one more time?
So there's the viral vector style vaccine, there's the mRNA vaccine, and we said that we've fast-tracked this whole vaccination, and so therefore the thing we lack mostly is the long-term side effects. So why should I pick the mRNA style vaccination if it's relatively new over the viral vector vaccines, which is more we've used it historically, and therefore the side effects I will be more familiar with in terms of if I did research on such similar vaccinations, I would see what the side effects are there. Okay. So why would I then pick the mRNA vaccine over the viral vector vaccine?
Well, it would kind of be erroneous to say that one is better than the other, especially at this point. As far as like history tells, when you do compare all three to the vaccines that have been out, the numbers actually are a lot better with these three vaccines, like more, with the mRNA and the viral vector, as opposed to the previous vaccines like the flu shot, which only had like an efficacy rate of less than 50%. Even though there are two different, there's mRNA and viral vector, the mechanism is sort of similar in the fact that they just only insert a small piece of the virus, which for the mRNA, and then for the viral vector, it's just a spike protein. So they basically work the same way, and they do mount the same immune response in your body, which is basically increasing the antibodies and creating an immune response. So in a sense, it would, for me personally, I'm a lot more confident with these three vaccines as opposed to everything in the past. Even though time and data is not really on our side right now, these are unprecedented times. But I will say that, 95% effective rate and 95% effective rate for these mRNA vaccines is a lot better than most, if not all, the previous vaccines that have been out there. So, yeah.
Okay, thank you. Does anyone else want to add to that? Thank you, Priscilla.
Yeah, I'd like to add one more thing. I think when folks hear the term mRNA, it kind of scares them, right? What the hell is an mRNA and why are you giving it to me? DNA, mRNA. But I think we should all understand that viruses have, all viruses, whether it's a common cold, hepatitis C, HIV, they all have genetic material that when they infect your body, they put that material into your cells. And mRNA, viruses have their genetic material encoded in either DNA or mRNA. So these are things that we have been getting exposed to and infected with into our bodies on a daily basis from the beginning of time. Okay, they're not given some special sort of drug. These DNAs and mRNAs, we get them anytime you get a common cold, anytime you get any kind of viral infection, they get put into your bodies by the virus, including some of these viruses that we're talking about. So I think, I hope that sort of quells some of these fears about the fact that we are putting an mRNA, into the body. It is just a way of allowing your cells to make the same proteins that the viruses make anyway. And it's safer because it's been tested in animals, for many decades. Even the stuff that we're using now, these mRNAs, they've been tested for decades. So that's kind of how I look at it, that these are things that viruses bring into our bodies on a daily basis.
Okay, thank you. Just like to ask as well, does the vaccine protect me from all coronaviruses? And then why can I still get it if I've taken it? So if there's two folds, can it protect me from all coronaviruses? And also, if I know someone that took the vaccine and then she also got the virus straight after, why is that the case?
So I can speak a bit about that. I think kind of going off on your point, Dr. Boateng, I think we should have probably started off with an explanation of what a virus is. So I think it's really important that you did that. And as you said, so a virus is neither dead or alive, to be honest. It's just a collection of material, organic material. So it will have genetic material. So as Dr. Barson said, DNA or mRNA or other kind of RNA, and covered by a protein shell, and then covered by another membrane which has proteins on it. And there's a reason why I'm kind of explaining all of this, because I think it's important to realize what we're doing basically. So you've got genetic material, a shell, a membrane, and then proteins sticking off the membrane, and that's a very, very simplified explanation of what a virus would look like. Okay. So when a virus is outside, kind of in the world, not in a cell, it can't replicate. It's just there. It's not doing anything. Nothing's happening. It needs to be in a cell in order to make copies of itself. It can't do that otherwise. So once a virus gets into a cell, it then can do all of that stuff and then wreak all the havoc and all that stuff. The way that it gets into the cell is those proteins which are on the virus that we mentioned. So it's kind of like a lock and key mechanism with your cell. So there's a part of your cell which can connect with a part of something else, like a protein, and that will allow wherever it's connected to come into the cell. Okay. So what these new vaccines have done is they have tried to replicate the part of the virus which enters into the cell, the protein or one of the spike proteins, and then from then an immune response is formed, and so your body kind of goes, oh, okay, whenever we see this is what we're going to do. And that's kind of, and that's an explanation as to what a vaccine is and what an immune response is. But I think it's important to understand what a virus is. So in terms of the vaccine protecting you against all coronaviruses, that's unlikely to be the case, because this vaccine would have been made for the current virus. So it's the SARS-CoV-2. That's the type of coronavirus which is causing the problems that we're having now. That's the virus that causes COVID-19. So the vaccines have been made for SARS-CoV-2, for the spike proteins which are on that particular virus. So I mean, it might somehow be able to protect from other vaccines, so other coronaviruses. It's unlikely, because that is the specific one that they've been created for. And there's some point in terms of becoming sick straight after you have a vaccine. So the vaccine doesn't protect you straight away. We know that because your body needs time to mount an immune response. So if you had the vaccine, today, for example, and you were exposed to coronavirus today or tomorrow, you might get sick. It doesn't protect you immediately. Second of all, with these vaccines, you need two vaccines, so one and a booster shot, to increase the chances of your immunity kind of being boosted. So again, you know, you could have had one shot, and it does help you mount an immune response, but not necessarily one that will kind of protect you 100%. And no vaccine protects anyone 100% anyway. Having said all of that, let's say you have both shots. Can you still get sick? Yes, essentially. So what we said before, the vaccine is teaching your body what to do if your body becomes infected, or if the virus comes into your body again. So it doesn't necessarily stop the virus coming into your body. What happens if it does come, then it's able to fight it quicker. So you're probably going to be less sick if that happens, if you're going to be sick at all. So yeah, no vaccine is 100% kind of make you immune. They usually reduce your chances of getting sick if you do get it. And some of them do also reduce your chances of kind of becoming infected. But a lot of them are reducing your chances of disease rather than chances of infection. But again, it's one of those things where we need that long-term data to know which one it is in terms of these vaccines.
So can you clarify? Thank you. But I have a few questions in relation to that.
Yeah.
Can you clarify in terms of the chances of disease and the chances of infection? So what the difference actually is, just so everyone's clear.
So chances of disease is if the virus is going to make you sick. So if you get the virus in, are you going to become unwell? Are you going to kind of become like, are you going to have like loads of symptoms, or how severe it's going to be? Infection, it's not going to infect you. So like you're not going to have coronavirus in your body if you have the vaccine.
So you're not going to have coronavirus in your body if you have the vaccine?
Yeah, so you can, so either you can't, either the virus won't be able to kind of stay in your body, or you know, like you won't be able to stay in your body, or it will reduce the chances of, if the virus comes, you becoming very unwell, because your body will be able to fight it quicker.
Okay, so with that being said, open to anyone. Thank you again, Jess. Open to you as well, Phil. With that being said, once I take the vaccine, I can still get it? Like the chance is less likely, but I can still get it. But then also, can I still spread the virus? So if I have a friend who's shielding, can I then say, hey, let's have a party today because I'm vaccinated and I'm not walking around with the disease? Can I still catch the disease once I've taken the virus? I'm not going to die now. I know the efficacy of the survival rate and my immune system can fight against it comfortably, but can I still catch it at the same rate, or is the rate lowered as well?
You mean, can you still spread it?
Can I still spread it? Sorry, that's the main thing.
Yeah.
Mm-hmm. You can still spread it, which is why it is important to still follow, you know, social distancing and wearing a mask, because up until that point where, you know, the desired amount of the population has been vaccinated and can create herd immunity, it is important to still do your part and still, you know, mask up and just distance yourself and just take proper precautions from spreading it, because you can spread it.
Thank you for that. Also, just to let you know, you can send your questions in via Zoom. So I'm going to ask a few questions that people have sent beforehand. So the virus affects us all in different forms. So what if my body cannot create its own antibodies? So for example, so many people have gotten the virus. I think I had it asymptomatic. Somebody else had it, they died. So what if they get the virus and their body cannot produce its own antibodies? Or maybe they have an extreme reaction because of the virus, because of the vaccine. How likely is that? So someone with comorbidities, they have underlying health issues, and their body is, maybe if they had caught the disease, they would have died from the disease. And now we've given them the vaccine. How likely is it that they are able to not be able to create their own antibodies? Or is that not a possibility?
If someone has any issues with their immune system, someone is someone has issues with their immune system, mount an immune response. So someone who's on medication which might suppress their immune system, or someone who has an immunodeficiency like AIDS, then they don't have an immune system to mount a response. And I believe at the moment that people who fall into that category are not advised to take the vaccine because they don't really have immune system to be able to mount an immune response. In terms of people who have comorbidities who would have passed away from getting the virus, it's unlikely that they will have issues in terms of becoming sick from the vaccine, because as we've explained, the reason it's just a part of the virus enough to recognize what the virus is. It's not the whole thing. It's not even the viral mRNA itself. It's just part of the part which creates the protein. Going to
Jessica, I'm going to allow someone else to answer that only because you're distorted. I'll come back to you. Yeah, so can someone else answer that or add on to what Jessica was saying? So in terms of, she was saying that if you are immune suppressed, like you have HIV and the likes, you might be advised not to take it because your body can't build up its own immune response. Can anyone else add to that? Is it me or should I put my teacher hat on? Dr. Mansky, can you answer that if possible?
Hello. Yeah. So what Dr. Jessica was talking, right?
Yes, yes.
Yeah. What Dr. Jessica was talking about, saying that the person, you asked the question about how you can get the vaccine and your body may not mount the enough reaction to produce the antibodies. Now, for the normal person, once you have these introduced into your body, we expect the body to form or have an immune response to generate antibodies, because on the normal day, on the regular day, your body is producing antibodies because it's being exposed to antigens every day, right from birth to when you're old. Good. But then we know that there's some conditions that may suppress your immune system. Now, if it's suppressing or your immune system is suppressed, meaning that it may not mount an effective response. So if the immune response is not that effective, we may not have the desired results that we want. For people who and are on medication, once someone is having HIV and is on ARVs, and the person, especially if the person has achieved viral suppression, the immune system at that point is strong enough to mount an immune response. But when the person is not on medication, is at the 4th stage, 8, that's quite an extreme, and such a person wouldn't even be stable enough to even take the vaccine. Okay.
Okay.
And
so,
then,
Karen, sorry.
Oh, please go ahead.
If somebody has an ailing aunt or a mother, so in their late 70s, they're quite ill often, and you don't know whether they have their immune suppressed, but they have ailments so much, should they still take the vaccine?
Yes. So if the person is maybe hypertensive, diabetic, or have any condition, let's have in mind that these ailments or comorbidities would also predispose the person to having severe to critical forms of the COVID-19 infection, leading to death. And one of the main purposes of this vaccine is to prevent people from getting severe forms. So these are people who actually need it more than even younger people. However, the person should be stable enough to take it so that the body can mount that reaction or that response to the vaccine.
Okay then, thank you for that. Next question. If I have had the virus in the past, should I take the vaccine? Because surely I have built my own immune system. My immune system has built an immune response. So should I still take the vaccine?
Yes.
Okay, so I'll start. Okay, Priscilla, please go ahead.
No, it's fine. You can go.
Oh no, Priscilla, please go.
Ladies first, Priscilla, go on.
Okay. Okay, so I will say yes, just for this fact that even though, you know, those who have been infected previously, they may have developed antibodies from the virus. There's no real data on how long those antibodies will last in your body. So you know, you have to like do a risk benefit analysis, and more times than not, it is beneficial to just be on the safe side and just be vaccinated, just to, you know, basically cover all your bases.
All right, okay. Dr. Mansi?
Okay, so what I would add to it is that we know there are cases of reinfection. I have personally attended to cases of reinfection where, and we don't know the exact amount or duration of the natural protection that you have when you get infected. Various literatures give different time frames. At least we know from 3 months, at least up to 3 months seems to be common amongst most of the literature, but then above 3 months, we are not sure. So then, safe to say that even if you've been infected before, you should take the vaccine, because mostly after 3 months, you're liable to get another infection, a reinfection. And with a reinfection, you are at a risk of having a more severe form of what you had previously. So then those who have infected and also should also take the vaccine. What also came up, I think it's also linked to a question someone just dropped, is that with the vaccine, the antibodies last longer than the natural immunity that you get from getting infected. Okay, as of now, we can't say specifically that it's going to be lifelong or it's going to take some time because of the duration of. I think Dr. Boateng talked about the duration of how we still have little time. There must be more time to go through to understand the exact duration of the antibodies, how the antibody levels drop or maintain or rise. So for now, we know that it's longer than the natural immunity, but then we can't give exact amount. Is it lifelong? So with more research, we'll know whether after the 2 doses, we need a booster dose after 5 years or after 3 years. We'll get to know that. Similar to that was if we had to look into history, the yellow fever vaccine. Yellow fever vaccine initially was said to last for 10 years. You need a booster dose. Then later on, it was updated that, well, it's lifelong immunity now. You don't really need a booster dose after 10 years. So with science and technology development and more research, we would have more information on that. But what we know now is that the vaccine gives a longer coverage or longer time of protection than the natural infection or the natural immune response or the natural immunity you gained from getting infected.
Okay, thank you for that. Does anyone else think someone wrote there the vaccine?
Can I add a little bit to that?
Yeah.
I think by now a lot of folks know that there are a lot of unknowns, right? So you know, we don't have a perfect answer to that question, whether if you get the virus and you recover from it, you know, we all know there's some immunity that you will have after that, should you get the vaccine. What we do know is that you know, when you get the vaccine, we know the type of immunity you're going to have. You're going to have an immunity specific to the spike protein, which is how the virus gets inside of your body to begin with. And the ability for the virus to really get inside of your cells is protected to some degree. When you get the virus, as Dr. Fletcher, nicely, took us through, virus 101. When you get the virus, there are many different viral parts, right? There are a number of, dozens of proteins in and around the virus. And so it is possible you might mount an immune response, not to the spike protein that allows the virus to get inside of your body, but to some other protein, once the virus sort of broke down inside of your cells. So it is not a controlled type of immunity. We know unequivocally that you're going to have some immunity, but we don't know what type of immunity that you're going to have. That's why it's still recommended to take the vaccine. Now, there was a study done in England looking at healthcare workers. It's about 12,000 healthcare workers who had the virus, and they just watched them to see, what influenced reinfections. What are some of the things that influence reinfections? So what they found was, if you had the virus and you had antibodies detected in your blood, then you had a very low chance of getting the virus again, or getting a symptomatic, getting actual disease from the virus. But if you did not have the antibodies detected in your blood, you had a 10 times higher risk of somebody who did. So then the question becomes, how long do these antibodies last inside of your body? And we don't know, right? We don't know. I've had, some folks that I work with who, some have had the antibodies, basically disappear from their bloodstream within like 2 months. They go get an antibody check and it's no longer present. So those are some of the reasons why, we still think that it's better to get the vaccine, even if you've gotten the virus, because we just don't know how long these antibodies last, in your bodies.
Wow, thank you for that. So if after every few months I have to take the vaccine again, can I then do a cocktail vaccine? So today I'm taking Pfizer, then the next set I take another set of vaccines. Is that advisable? Or once I start one set of vaccines and I finish the second dosage, in 6 months' time I should continue and always use that same set of vaccines? Or is that not being discussed yet?
I mean, I think, in time, those questions will be answered. We're sort of still getting through the very early phases of getting the vaccine, but there's no reason to think that you wouldn't be able to get a different vaccine if you got, if you got vaccine A, there's no reason to think that you couldn't get vaccine B, 2 years down the road or a year down the road. I mean, we get vaccinated with different vaccines all the time. So I think, we need a little bit more time, but we'll get there. But I really don't see any scientific reason why you wouldn't be able to get a different type of vaccine if you had one type of vaccine.
Right, okay. I think Dr. Priscilla touched upon this, and Dr. Jessica as well. If the vaccine doesn't prevent, the efficacy is not 100%, once I take it, how much of normality should I be expressing? In London, in the UK, the lockdown's been lifted in June the 21st, and everyone thinks life will go back to normal. How true should our lives go back to normal, in your opinion? Or how much?
I think it's all going to take a while. And like the past 12 months, or probably more than that now, have turned everything upside down, and the virus has, we all know what it's done. And I think in order to say, it's difficult to say when everything's going to go back to normal. In terms of, and Dr. Priscilla touched on this as well, in terms of herd immunity, there needs to be about 50 to 80% of the population in the UK vaccinated in order to kind of get to a point where we have herd immunity. And herd immunity is when basically enough of the population have been vaccinated so that the disease is a bit more under control for people who can't be vaccinated. So like we spoke about people who are immunocompromised and people who can't, all those things. So 50 to 80% of the population need to be vaccinated in order to get to that point. So I guess we need to figure out what, in terms of things going back to normal, like what that looks like what exactly that would, we'll probably need to find what that is first. If it's herd immunity, then that's the amount of people that need to be vaccinated of the population. So it's quite difficult to say like when things are going to go back to normal. Right, okay. if we don't have a specific kind of point of.
I'm going to ask one more question, and then I'm going to get the experience from Dr. Mansky and Kobi Annan about how they feel having taken the vaccine, and then come back to a set of questions. So there's a lot of conspiracy theory, more than ever with any of the other vaccines. I mean, I've taken yellow fever, I've taken this, I've taken that, and I'm scared of injections, but I haven't been afraid of the side effects as much as now. And there are speculations of fertility, it affecting your fertility. Where are these coming from, and how true is it?
Can I start something here?
Yes.
So I believe that Dr. Boateng started saying how, I'll make reference to what he said, the duration, the usual duration where vaccines are made, this one has been, in quote, sped up. So it came out faster than the usual. So once again, people are questioning the safety of it. And unfortunately, we're in a time where I think information dissemination is at its peak now, where one tweet can just go out to virtually half of the world, different parts of the world, and it's already there. So information spread is at its peak, and now the world is literally a global village. So so much information overload, and most of these information may not be from credible sources as well. So the fear of the unknown, fear of its safety, and the panic that COVID-19 actually, the anxiety and panic COVID-19 also brought, has also mixed up with all these things, with conspiracy theories. We already had anti-vaxxers and the anti-vaccine theories out there previously, but it wasn't so much as this, because now people see that the duration that usual vaccines take has been shortened. And within a year, we have a vaccine. Whilst we know that usually takes years and years upon research, clinical trials, safety trials, and everything before a vaccine actually comes out. But here we have vaccines come out within a year. And then the things we can't answer about the vaccine that is even out now, because the time is quite short. Because even here we've answered, it's not everything we can answer. Hello, can you hear me?
Yeah. You cut out for a bit, but
yeah, it's not everything that we can answer. So that also boosts the conspiracy theories and the myths and everything.
Dr. Mansky, you're really trying. Must remind everyone there is a power outage currently in Ghana. Someone's written, the way it was sped up with the data was being given to the regulator was in the real time, as opposed to waiting until the study was over before handing it in. Has anyone else got something to say about the extreme side effects that people are throwing out there that have really got people scared?
Oh, I just wanted to kind of speak on just make one opinion. Yeah, I just wanted to first of all just make one point about like the vaccine being sped up. So sorry, I'm gonna go into another long explanation, but this is gonna be a lot shorter. I think it's, again, I just think it's important to understand things before. Yeah. Anyway, when something's been developed, a vaccine, a drug, or whatever, it has to go through, there's been like a queue, essentially, of, you know, to get funding, to get things approved, to be able to start. You can't just kind of say, oh, I've got a new idea for a hair loss cream and I'm just going to try it. Like, it has to go through stages, and there's usually a queue. With this, obviously, we know how it's affected everything that's happened. So it essentially got to jump a lot of the queues in terms of having things started, having funding and things like that. The steps of the trials were not any different. They had animal testing, they had phase 1, phase 2, phase 3 human testing. Those have happened as they would. On average, the trials had about 30,000 or 30 to 40,000 participants. So the things that they need to do for trials have happened. It's just that what was fast-tracked was a lot of the bureaucratic things. It's just like, I was saying to someone, it's like getting a visa. How long does it take to get a visa? It's probably a day, but like, you have to be in a queue for however many long, because that's just how it is. The actual visa itself takes a day, so it's not that takes time. So anyway, I just wanted to address that in terms of like things being like sped up, like the actual process, the speeding up was an actual process, and it was tested for safety and efficacy and things like that. Cool. I think in terms of the theories, I think so much has happened this year, which has never happened in a lot of, which is, I'm just going to mute this person if I can. No, I can't. Okay. So much has happened, which is likely never happened in a lot of our lifetimes. Like, nothing like this has ever happened, and so people are going to form ideas about what they think it means, and there are going to be things that are difficult to explain, and so people tend to form explanations. And sometimes when bad things happen, we feel like there has to be some kind of like ominous explanation, and sometimes it just is what it is. Also, a lot of times the theories come from things which are have a little bit of truth, or not even truth, but they come from a point where someone has made a point, and then it's just been extrapolated to the furthest degree. So for example, in terms of the what people are saying about fertility, that basically arose because the spike proteins that we spoke about, the ones that the vaccine tried to mount an immune response with, are similar to a protein which is needed to make placenta. So the thinking was, if you have a vaccine against this protein, are you also going to, mount a response against placenta, and therefore it's going to cause issues with fertility? But that's not really how it works. So the proteins are similar in that, like, they're proteins, but they're only very, very slightly similar. They're so different in so many different ways. But having that thought, or someone basically just saying that and not explaining that, someone can hear that and just say, oh yeah, it causes infertility, or it causes problems with pregnancy. So I think it's having a little bit of information is actually quite dangerous. I think people need to be able to do the research. Someone was going to say, do the research and actually find out the information, and you'll find that a lot of these things have no basis, and it's just people just being afraid, because it's frightening what's going on. But yeah, we need to be mindful of what's being put out. I'm going to stop talking now. You can just shut up when I'm just going on.
No, very insightful. I'm going to hand it over to.
Can I make one point about the speed of the vaccine? I think there's been a lot of concerns about the speed of the vaccine. So, one of the ways that I think about it is, aside from some of the bureaucratic process that slows, the the process of approval of a vaccine, you also have to look at how rampant a particular condition is that we're trying to vaccinate against. So, in many instances, it takes time, because for you to determine whether something works, whether a vaccine works, you have to have had a number of people, get that condition, and you could compare the treatment group to the placebo group and say, one group was better, right? And sometimes when a condition is not very common, it takes a long time. So, if it's not a common condition, you may have to wait a year before you get some people infected. But this virus was so rampant that, aside from getting the volunteers, there was enough data to show that one group was clearly better than the other group in a very short period of time, because a lot of people got infected. I think, in both the Pfizer and the Moderna studies, they needed to show that they needed over 100 infections in order to be able to show differences between the two groups. And they got those many, that many infections within that 2 to 3 month period. Yeah. And so part of why the study happened so quickly is also because it was so rampant in our communities that every day people were getting the virus. And so they can show that one group is getting it faster than the other group. Conspiracy theories, that's always going to be there. I think it's really, it's up to us to really just sort of look into it and see where those theories are coming from. We have conspiracy theories in government and all these things. There's just no way to protect against that with the way information is disseminated nowadays. So this is very difficult to shut down these conspiracy theories.
Yeah, I'm going to move on. Thank you. I'm going to move on to Kobi Annan, and he's going to tell us about his experience having taken the vaccine in the UK. And then I'll move on to Dr. Mansky, who took his vaccination this week in Ghana. So Kobi, how are you?
I'm great, thanks, Jackie. Apologies for not showing my video. It's Sunday evening, but yeah.
You're the first person to have no unmuting issues, to be honest. Very quick.
Yeah. Do you want to ask questions, or should I just jump into it?
If you can tell us a little bit about your history, if you don't, as much as you can, and then your need to take the vaccine, and then also how you felt shortly after and now long term. Can't remember when you took it, so if you can give us the dates roughly.
In terms of history, I suffer from sickle cell. So throughout the kind of COVID pandemic, I've been shielding at home, listed as what the UK government and the NHS called clinically extremely vulnerable, which was a list of certain conditions who they thought would be at risk of contracting or suffering the worst effects of COVID if we were to get it. And so we were placed in one of the priority groups to get the vaccine, along with elderly people and frontline healthcare workers and things like that. So I was invited to take it. I'm afraid I can't remember the exact date, but sometime in January. I'll be very honest, I had my initial skepticism, so I didn't straight away kind of jump on the invite. I was actually sent a message just by the hospital I attend. They sent me a text message and just gave me a link to follow to do it online. But I spoke to quite a few people who I know in the medical profession and some people who had been tangentially involved with the kind of temporary approval process here in the UK who put my mind at ease and said, look, from what we know right now, you're better off getting it than you are not. I think like most people on this call, or a lot of people on this call at least, I had reservations as a Black man and as someone with an underlying condition as to how well represented we'd been in trials and what the longer term effects may be on sickle cell patients or people with other kind of comorbidities. But I was told by someone who was a bit closer to the process that, look, if it was down to just the drug companies alone, they wouldn't be so sure, but actually the regulation process is so stringent that even though it's sped up, that will catch, like, you know, there's not free license to just do whatever the drug companies want. And if it wasn't safe, it wouldn't have been, you know, given even emergency approval. So that put my mind at ease. So I then kind of went through the link that I was sent, and I was given a choice of lots of different dates and times to go and take my vaccine, which I did. I was given the Pfizer vaccine. There was no question ever of a choice. You just turn up and see what they have on the day, or what that particular center is using. And in my case, it was the Pfizer vaccine. I'm one of the few people I know who've had Pfizer. I think mostly in the UK, it's AstraZeneca that's widely used. It was quite a lot of waiting around, forms to fill in, a lot of explanation about potential side effects, lots of screening questions about whether you've had other vaccines recently and your kind of general health history, your COVID health history. You're given a lot of material to read about, you know, the vaccine that you're going to be taking, what it does, what it doesn't do, and how to kind of behave afterwards. Then I took the vaccine itself. It took all of 2 seconds. And then because I took it in a hospital setting, I had to sit down for 15 minutes to be observed to make sure that there was no initial immediate reaction, which there wasn't. So you kind of go from where you take the vaccine into a waiting area, sit down, just with a nurse, a couple of nurses watching over people. And then once you've passed your 15 minutes, off you go. I was very lucky. I had absolutely no side effects whatsoever, aside from a sore arm. But I think most of us who've had an injection before will know that that's quite standard. And yeah, no fatigue, no headaches, no pain, nothing else. And that's that. So I'm due for my second vaccine, I think. Sorry, I took it on the 7th or 8th of February. I can't remember the exact date. And I'm due for the second one on the 24th of April. In the UK, we've been extending the period between doses to 12 weeks, which not all countries have been doing. But my understanding is that the literature is now supporting that as still highly effective. Though I'm also hearing that there may be some shortening of that time, or you can just kind of show up at some centres and get your second dose after a certain period, regardless. So I'm due for the second one on the 24th of April, and I'll be happy to have it. As I say, no side effects or anything since then. And yeah, that's it.
Can I confirm that the second dosage is the same as the first one? It's just a top up, or does it contain something different?
As far as as far as I know, it's the same. Maybe one of the doctors might be better placed to answer that, but
yeah, no, it's the same.
But I do believe it. They refer to it as a booster, but I think it's the same product.
Okay. And also, you've been shielding since the lockdown. What will that mean once you've had your second dose? What would your shielding or day-to-day life then look like? Will it be a little bit more relaxed? What have you been advised?
So the advice is to, and bear in mind, I took this before the kind of, in the UK, the announcement of our roadmap out of kind of the lockdown. Yeah. So at the time, the advice is basically change nothing. You know, act, and as I had been doing, act as if anyone can give it to you, act as if you can give it to anyone. It just so happens that my second dose will coincide with things being a bit more open in the UK. And so since I've had my first dose, I haven't changed anything. I haven't been going out more places or doing anything differently. And it's made quite clear to you in the literature that you get and the kind of talk you're given on the day that, yeah, you know, just kind of carry on as you were before.
As you were before, okay. I'm going to thank you for that. I'm going to move on to Dr. Mansky and ask him about his experience as well, since he took it last week.
Okay, so I took it on Wednesday, because I think like 5 days ago, and I took the AstraZeneca vaccine, the AstraZeneca Oxford. That is currently what is being rolled out in Ghana now. So, well, that is what you're taking. Like, I mean, till we start running the Sputnik from Russia, that's what we'll be taking. Personally, I didn't experience any fever or chills or headache or tiredness. The next day I experienced some very mild back pain, which resolved in a few hours. But then I realized that I seem to be drinking a lot of water and then eating a lot of food the day after. Well, other people too were complaining of that because I didn't really know what that was because I'd never actually read that as a side effect. So other people also were complaining of that. And one of the numbers that you'd call if you have an adverse reaction, my number was floated as part of it for the vaccination sites attached to my facility. So I had calls coming and people were informing me of their giving me feedback, and most of them was with fever, chills, headache, tiredness, and then most people fever, chills, tiredness, and then headache. Basically, that was the most common one that ran through. But then again, these were most from people who were. So this is a small sample size, just the number of people who were at the sites attached to my facility. Let me give this disclaimer. Most of these people that I had or I came into contact with who had the fever, chills, tiredness, and headache were mostly below 60 years. More really the health workers who are within, let's say, 20 to 40 or to 45 or to 50. But then the elderly people above 60 who actually took it, very few of them actually came with such complaints of fever, chills, headache, and tiredness. So that's one thing that I also realized in our place amongst the people that I came into contact with. Okay. And then I think you asked the question about how that affects, after the vaccine. So now what next? For me personally, what it means for me is that, so for someone who was attending to COVID patients and attending to normal patients as well, yes, I still go ahead making sure that I'm well protected and everything, but psychologically, I'm a bit more at ease when attending to a patient, because even if I don't know the patient's status, whether the person is COVID positive or negative, I'm a bit at ease because I know that at least there's some form of protection or extra protection now compared to previously. Yeah.
Okay. Thank you for your both of your experiences. I'm just going to ask a question now. Kobe, is there anything else you wanted to add?
Nothing to add. Happy to answer anyone's questions if they have them.
Yes, I'll give you the opportunity as well. So do put your questions in the chat box. The question that was here is, do we know whether we can refuse it, and also what our legal standing is if we receive long-term issues from the virus?
From the virus or from the vaccine? Because there's nothing for the virus.
The vaccine. I'm sure, no, it's the vaccine. They meant the
vaccine. So what was the first? Can you refuse it?
Yes. Yeah. Is there any legal standing that if you refuse it, there will be any implications there?
Not at the moment. I don't think anyone.
So not in the UK.
I mean, I don't know how they would enforce that. Sorry.
What about in America and Ghana? Is there any legal binding?
At this time, no, there isn't. Because of, there's very limited data available on the long-term effects of it. But depending on how things will go as time goes on, I don't see, like, if best case scenario, we all reach herd immunity and, the crisis is handled. I really don't see I actually see the possibility of it being a requirement the same way it's a requirement for healthcare workers to get the flu shot every year. So it is possible that there will be some requirement of some sort, but of course, no one can strap you down and force you to, take it. I'm sure you also have the right to refuse. And if you do refuse, there should be some sufficient documentation to prove that. But that is definitely later down the line if that even happens, but yeah.
Okay, thank you. And then also, I suppose we don't know the answer to if you have any long-term side effects, could you then claim or do anything in regards to that?
I don't think that's happening. That's not going to happen.
Sorry, just to jump in on that, through my work, I do know that Ghana has, so basically people who get the COVAX, who get doses of the vaccine through COVAX also have access to a facility, a pre-compensation facility for people who do suffer long-term side effects. That's for people who take so for people who are in Ghana and you were to suffer side effects, I don't know how you would go about it. I guess contact whoever you got the vaccine through, but it's part of the COVAX facility that there is a fund to compensate people who do have longer term side effects.
But that's a question for you. So is that in regards to those who have participated in the trial, or is it for the general population?
The general public, yeah. So if you've had a vaccine that's been acquired under COVAX and you have an adverse reaction or a longer term side effect, then there should, in theory, be a pot that you can draw compensation from. I'll find a link and drop it in the chat.
Thank you very much. Someone else wrote that, who is to say that these, so the side effects such as, bear with me.
I'm sorry, what was the question?
Sorry, someone wrote the side effects to the COVID-19 vaccines now include persistent malaise and extreme exhaustion, multi-system inflammatory syndrome, chronic seizures, convulsions, paralysis, and sudden death. Who is to say that these side effects won't be the case after 6 months of receiving the vaccine? So that kind of ties into the previous question. So there's these extreme side effects. How do we know that then you won't catch it, you won't have these side effects reflected 6 months down the line?
I mean, I don't think anyone can, you can't really predict the future. I don't think that's a really fair question. I think it's difficult to say what's going to happen in 6 months' time. It's just, on the balance of probability, it's probably not going to happen. It's, it's about likelihood, isn't it? I can find you a list of side effects of other medications which sound very similar to that. We know that everything has side effects. We know that people report side effects when you give them placebo or when you give them a medication or when you give them a vaccine. It's not to say that it's not happening, but the commonest side effects are the ones which have been spoken about: fever, being tired, being fever, being tired, having some muscle aches. Those are the commonest ones. Most people will. Oh, sorry, you speaking, Jackie?
I wanted to add to that though.
Yeah.
Okay, so I will say that, those are side effects, and like Dr. Jessica said, we can't predict the future. These are unprecedented times. There are unfortunately there are more questions than answers in this situation. However, you do have to see it on the side of, that there are possible side effects, but then if you don't protect yourself, you can die. So you got to kind of look at it that way, that, you see that COVID has killed over 2 million people worldwide. And, as far as the side effects to those who have received the vaccines thus far, it's very far and few in between that it's been something fatal. Not to say that it hasn't happened, but, compare that to the fatalities of COVID-19, it's kind of like, you obviously see that it's a no-brainer in a sense. So that's how I kind of break it down to those who ask me of it, that, it protects you from dying. Like, all the vaccines are out there. They all, once you've completed the series, they 100% protect you from, the severe form of COVID and hospitalization and even death. So you may feel, malaise, you may feel a bit feverish for a few hours or even a day, but later down the line, it will protect you from it becoming a lot more severe to the point that you pass away. So.
Can I chime in on that? I think the way this virus has really come up and really become perverse in our world, these conversations about vaccines, it's very difficult to. It's very difficult to, for this idea of side effects of the vaccines to be ironed into the minds of people, because we've never really had a time where we spoke about trying to vaccinate the entire population, right? It's never happened. We've never had that conversation before. So, let's just take the United States, for example. Something like, on average, anywhere between 5 to 10,000 people die every month, just just from not, just from whatever various causes of death, heart disease, cancer, etc. So now, I think just this weekend, I think there are about over 300 million people in the United States. We've vaccinated, whether partially or fully, we've vaccinated somewhere around 80 to 90 million people. So we're getting close, and we just started vaccinating about 2-3 months ago. So it is possible that at some point we're going to get close to that half population or 3/4 population, and people are still going to die from just general causes. So it's one of these things where, if you could imagine that we vaccinated all 300 million people and 5,000 people died every month, people could still say that people are dying because of the vaccine. I mean, it's a no-win argument. There's just really no way for the vaccine to win that argument. And so I think the more the vaccine becomes common, the more people are going to die. I mean, not from the vaccine, but just people who have received the vaccine are going to die of other causes, and it's only going to get worse. That's an argument that it becomes increasingly difficult. What we can say is, in the study of both Pfizer, Moderna vaccines, they each had about 40,000 participants. So you put them together, that's 80,000 people. Nobody died, over that 3 to 5 month period. And now we've had over 80 million people. 80 million people. Just understand that number. That's a lot of people. 80 million people have been vaccinated. They've had cases of people passing out. If I pull a needle to draw blood in my office, people pass out even before I give them the drug. So it's one of those things. But the data doesn't support the vaccine being harmful. What the data supports is now there's increasing data on long-term findings of the virus. So for instance, 7% of people who are in the ICU with the virus have, nodules found in their brain. They have, long-term lung function decline, decreased heart function. So all these things that are coming out with the virus. So I think you have to sort of take it in context of the damage that the virus is doing, and also of the fact that we're going to be vaccinating a lot of people, and other things cause people to have to die and to have some other effects. People are taking medication every day. People, it's a very difficult argument to really bring up.
Thank you. I'm gonna read some of the questions. It says, can you speak to the COVID vaccine safety for people with multiple allergy issues, for example, eggs, certain foods, food dye, latex? Is one vaccine preferred over the other for this group of people?
I think it's a matter of finding the vaccine that doesn't contain the things that people are allergic to. So it's not to say that if you're allergic to egg and the vaccine doesn't have egg in it, you're going to have an allergic reaction. You need to find out, basically need to find out whichever, like what's in, if those allergens are in whichever vaccine, if that makes sense.
So the Pfizer and Moderna one do not have any egg or latex in it or any type of preservatives. They do have a polyethylene glycol. So if you're allergic to that, then you would just have to consider other options. Just like Dr. Jessica said, you just have to really do your research, and that is public information as to what ingredients are in those vaccines, and then from there you decide which one you would prefer.
Thank you for that. We're going to be rounding up in a few more minutes, so if you can send in your last questions. I've got a question here stating, am I right to state that the free supplies are, this is related to Ghana, am I right to state that the free supplies are good, but if Ghana doesn't purchase more to vaccinate its people, then it defeats the purpose?
Yeah, I think I agree with what the person is saying, because with the concept of herd immunity, like Dr. Jessica said some time back, we need to vaccinate about actually defeating that purpose. There's actually a plan in place to get more vaccines into the country. Talking about Ghana, there's a plan by the government to get more vaccines into the country, aside from the COVAX facility that is supposed to give us a total of, I think, 12 million. And then I think the Tony Blair Foundation, Ghana Private Sector Fund, and the Indian government as well would be pitching in as well. And then the African Union too would be bringing some on board. So total, I think we should be having about 31 million vaccines, or thereabouts. I'm putting into having in mind 2 doses each, because for now what we have are actually all 2 doses. We don't have the Johnson & Johnson, which is 1 dose or 1 shot. We don't have that. It's all our 2 doses, the AstraZeneca and the Sputnik. And the government is also planning on buying the Sputnik as well. So hopefully we are expecting to get more into the country so that we can get more people vaccinated. But I think even with the 600,000 that we have in the country, we have a huge work ahead of us, because the conspiracy theories and the myths out there is serious. You have to do a lot of education, talking, and let people know that it's good they take the vaccine, because a lot of people are scared. Some are hearing a whole lot of things concerning the vaccine, so they're not so much enthused about going for it.
Just to round up as well, what's the last piece of advice or statement you'd give to particularly our older folks who might not be as well educated or informed in relation to this? So what's, rather than saying comorbidity, mRNA, how can we break it down to them to then ensure that they have the right choices in picking or taking the vaccination early as well? So if their rollout is called, like if now in the UK, the age rate is reduced, my mom falls into that bracket, how do I then encourage her to take it amidst the conspiracy, as Dr. Mansky is saying? There are doctors, that healthcare workers that are spreading these conspiracy or facts, whatever it may be, information, whether it's misinformation or not. What can we then say to them to encourage? That's a question for everyone, since we're about to close.
I think it's important just to have conversations like this. I think it's really, I like to know, as I mentioned before, I like to know why people are saying what they're saying, like, because then we can try and debunk what they're saying. So sometimes, like me personally, I used to get very annoyed, and I still do, I'm not gonna lie, whenever I used to hear them, because because it's so dangerous and baseless. But I think it's really important to just have conversations. Why do you think that? And then from then you can try and explain kind of the pros and cons. Because I think if you don't know what it is exactly that is causing people to be fearful, then it's difficult to counsel them. But if for example someone's like, I'm scared that's got microchips in it, you can be like, okay, well that's a place we can start from there, and then you can kind of break it down and explain that that's not what's going on and things like that. So I think just having conversations and coming from a point of trying to explain what it is that they're fearful of, so that it can be pulled apart and the benefits can be explained. Yeah, that's kind of my.
For me, I get questions like that every day at my job. For one, I do think that when we put ourselves first, and like in the sense of we as as healthcare providers, if we set ourselves to get the vaccine, I think that instills a lot of confidence in our patients and our loved ones alike, knowing that, you know, a loved one got it and they're okay with it. They're not growing a tail or they're not growing a third leg or anything like that. They can see that, you know, this actually does help. I think that's one way of, you know, instilling confidence and debunking a lot of the myths that are out there. And also just basically, like, for me, I just like to see things from a risk benefit way that, you know, yeah, like you may, like I mentioned before, you may feel some mild symptoms that may scare you, but like it will protect you from dying from this terrible disease. So that's another way of, like, you know, that's another point of conversation in regards to that. But yeah, I would also like just try to find out why they're thinking this and, you know, explain it accordingly, basically. So yeah.
Something I would like to add to what Priscilla just said. Health workers putting ourselves out there. What I did was I actually made a YouTube video of myself getting the vaccine, and then 2 days later on shared the side effects I had and put it out there, shared it all over with my friends, my family, and everything. And for the past 2 days, I've been having good feedback, people asking questions, and then you'd actually get to hear these myths, and then it would be a starting point to know how to debunk these myths, to address these things. And so more of these conversations would help as well, wherever the opportunity we can have to talk to people, to explain to people, to give people the full information. Because I think it's about the little information that is taken out of context and then the extreme forms put out there, mixed with some drama and whatever. So if we can actually give out the facts as well, it's true. Not everything is known about it, but then the pros definitely outweigh the cons. The advantages are better than the disadvantages. So you just have to talk to people, explain to people, for people to understand why they have to go for the vaccine.
I agree with everything that these guys have said. You know, just having more conversations with people, seeing what their fears are, and trying to you know, explain that particular area where they might be fearful, and explaining some of the benefits, and quite frankly, just going through these studies that were done, you know, that were done really extensively, will go a long way.
Thank you all. I'm going to end it here. We will kind of gauge if a part 2 is needed if we haven't answered all the questions needed. But I'd like to thank all 4 doctors, along with Kobe as well, for sharing your experiences and insights. Just like to introduce our platform again. It's Migration to Ghana, where we help those in the diaspora move to Ghana and have a seamless relocation, and also build networks of others in the diaspora as well. We will send, this is available via YouTube, so do share it as well. And in particular, the purpose of this was to give more information, give more understanding, proper information about the vaccine and the different types. There are different types available. So I don't think it's the place of anyone here to say what their preference is, but if you do your research based on this conversation with the mRNA and the other types as well, and doing your own reading up of whether it can cause side effects or what type of side effects, like the allergies there, please do that. Please share it, and share it to your parents and loved ones in particular. But thank you all so much, and I look forward to everyone's feedback as well. Take care.
Ciao.
Bye.